Hello, my name is Brian Aston. I'm the Director of Education and Training at Mindful Psychotherapy. Thank you for watching my video blog. I'm a therapist who specializes in trauma and post-traumatic stress disorder, specifically PTSD caused by interpersonal violence from all ages. I also work as a trauma therapist at an outpatient mental health clinic for crime survivors. This video is an introduction to the series of continuing education courses Mindful will be offering in spring 2019 to licensed social workers and helping professionals working with trauma interested in learning more about PTSD. This video may also be helpful for clients with a traumatized history to learn more and seek help. Many individuals who have a history of trauma are often reluctant to share their experience for fear of shame, blame, guilt, not being believed, or just not finding someone who gets it. I speak regularly with therapy professionals who express concern about their patients' trauma history, specifically interpersonal trauma stemming from domestic violence, sexual assault, childhood sexual abuse, witnessing domestic violence, human trafficking, but have difficulty addressing the actual trauma for the fear of overwhelming or re-triggering their clients. So often it gets put on the back burner or not discussed at all. Some therapists are unsure as to how to approach working with a client with a traumatized history, and some traumatized clients are unsure where to begin and who to trust. I find that it's critical to educate clients about what it means to talk about their trauma. In my experience, one of the most common misnomers about therapy, specifically for clients with a traumatized history, is that the client will have to divulge all details of their crime and discuss its specifics, therefore re-triggering old wounds and memories. On the flip side, there are clients who believe that if they just get it off their chest, they'll feel so much better. One of the most common trauma reactions is the experience of reliving the trauma. Too much exposure tends to be unhelpful and more damaging to the client, especially for someone who engages in extreme coping. A helpful metaphor to illustrate this point. Imagine yourself in a pool and you're standing near the deep end, but you don't know how to swim. Now imagine the feeling of jumping into the deep end without any swimming skills and the overwhelming feelings and sensations that may bring on. You may drown, not be able to breathe, panic, etc. Now imagine that you have a swim instructor with you in the shallow end. You dip your toe in first, then slowly start to immerse yourself in the shallow end. You start taking swimming lessons and learn the skills needed to get from the shallow end to the deep end. Compare the two feelings between jumping in the deep end with no skills and the feeling of slowly learning safe skills to make it there successfully. This is to illustrate the difference in sensations clients may feel between talking about the details of their trauma in the first few sessions to talking about the trauma 6 months to a year later. Traumatized clients have already had control stolen from them before. It is important for the therapist and the client to work as a team and take the time to build trust as the first step to help restore a sense of control and safety, preventing trauma-related extreme coping in the future. If you are a client interested in learning more or would like to set up an initial appointment, please schedule a consultation online at www.mindful.nyc or by calling 917-818-2128. If you are a professional interested in learning more about trauma or PTSD, please feel free to reach out with any questions. As I mentioned at the beginning of this video, Mindful will soon be offering continuing education courses to licensed social workers. Be sure to stay tuned. I will be offering a 2-part series that will expand on working with traumatized clients and have case vignettes to help further illustrate trauma-focused psychotherapy. Thank you for watching.